10-4 dispatch, I'll be on the way. Is there a reason why we're sitting here by the road? I copy, I'll be en route. What's going on today?
Every year in Bexar County, thousands of incidents occur where police respond to individuals in the midst of a behavioral health crisis. These situations can often pose significant risks, either to the individuals in crisis or to those around them. It's been common practice for police to either transport direct or call EMS to transport the behavioral health patient to a hospital emergency room for evaluation. After the hospital staff confirms there is no medical condition causing the symptoms, the patient must wait in the emergency room until a behavioral health bed becomes available for admission. Here's the problem. Most emergency rooms aren't equipped to handle behavioral health needs and lack inpatient psychiatric beds, placing excessive demands on staff and still not providing the necessary behavioral health care for those in crisis. Behavioral health patients often occupy hospital beds for hours or even days. This can potentially prevent sick and injured patients from getting the medical treatment they require. Once an appropriate bed at a behavioral health facility is located, a secondary transfer is required. This process further strains resources and delays the provision of appropriate care. This inefficient practice costs area hospitals millions of dollars annually and ineffectively utilizes critical and scarce resources like emergency room beds and ambulances. The Southwest Texas Regional Advisory Council recognized the burden this practice was putting on hospitals, EMS agencies, and most importantly, our behavioral health patients. So it developed the Southwest Texas Crisis Collaborative, a group of leaders in behavioral health, acute care, law enforcement, EMS, and representatives from both the city and county. Out of this group's efforts came the Law Enforcement Navigation Program. Here's how it works. When a police officer encounters a person experiencing a behavioral health crisis who needs an emergency detention, their first call is to Strax Medcom. Coordinators at Medcom are available 24/7 to assist.
Strax Medcom, this is Paulette.
Hey, this is 7924. I have an individual I need to take in for an emergency detention.
Okay.
The Medcom coordinator conducts a medical screening using a questionnaire developed by emergency medicine physicians in consultation with behavioral health experts. If the patient meets criteria, the coordinator identifies the nearest and most appropriate behavioral facility in real time.
Based on your current location, we can go ahead and get the patient over to Cedar Hills Behavioral. That's 1975 Babcock Road.
Okay, thank you. I'll be on the way.
Medcom then notifies the facility that a patient is on the way.
Hi, this is Paulette with Strax Medcom. I have law enforcement bringing in a 52-year-old male on an emergency detention. They have about a 15-minute ETA.
The Law Enforcement Navigation Program allows Medcom to load balance the entire system, preventing any one behavioral health facility from being overloaded. Strax's innovative program is working. Of the more than 18,500 cases Medcom received in 2023, over 12,000 were navigated to behavioral health facilities. That's a 67% reduction of cases that would have unnecessarily been sent to hospital emergency rooms. Since the program's inception in 2017, Strax's Law Enforcement Navigation Program has reduced emergency room expenses for patients that previously utilized the ER on an emergency detention by nearly $35 million. The program has reduced interfacility ambulance transport costs to the hospital by nearly $19 million since its inception. Those two savings alone, minus the cost to operate the program, have resulted in efficiencies that save more than $8.5 million healthcare dollars every year. Strax's Law Enforcement Navigation Program not only saves time and money, but more importantly, ensures that those experiencing a behavioral health crisis are directed to the right place, using the right method, in the right amount of time to receive timely, appropriate, and compassionate care.